Nutritional Pearls, Managing Copper in Wilson's Disease. Welcome to Nutritional Pearls, the broadcast where we dive into clinical nutrition tips for pediatric care. Today's episode focuses on a critical topic for patients with Wilson's disease, dietary copper restriction. Wilson's disease is an inherited disorder characterized by excessive accumulation of copper in the body, primarily in the liver and brain. This occurs due to a defect in hepatic copper excretion. While pharmacologic treatment with chelating agents or zinc is essential, dietary management plays a supportive role, especially during the initial phase of therapy. Let's break down the food groups based on copper content and what patients should avoid, limit, or safely consume. Foods to strictly avoid. These are foods with high copper content, typically more than 2 milligrams of copper per 100 grams. Examples include liver of any kind, pork, beef, or chicken. Shellfish, especially oysters. Nuts, particularly cashews and walnuts. Chocolate and cocoa products. Seeds, such as sunflower or pumpkin seeds. These foods can significantly worsen copper accumulation and should be eliminated from the diet during active treatment. Foods to limit. These contain moderate amounts of copper, about 0.5 to 2 milligrams per 100 grams. Examples include spinach and leafy greens, potatoes, shrimp, oatmeal, and whole grains. These can be included in small quantities, depending on the stage of the disease and the patient's copper levels, but require guidance from a dietitian or physician. Foods considered safe. These contain less than 0.5 milligrams of copper per 100 grams and are generally safe. White rice and refined grains, eggs, most fruits such as apples, bananas, and oranges, milk and dairy products, lean meats without organ content, such as chicken breast or pork loin. These should form the backbone of the patient's diet to ensure nutritional adequacy without increasing copper load. Patients should avoid over-the-counter multivitamins or supplements unless specifically prescribed, as some may contain copper. Once copper levels are well controlled, dietary restrictions may be gradually relaxed, but only under medical supervision. Sodium restriction should be applied judiciously, especially in individuals presenting with edema or ascites. That's all for today's episode on copper-conscious nutrition in Wilson's disease. Remember, nutrition may not replace pharmacologic therapy, but it strengthens the foundation for long-term management. Thanks for watching Nutritional Pearls. See you next time.